is my audience. My dad and my mom. So I wanted to start off by showing some pictures of the homelessness crisis in Venezuela. I found these pictures earlier today, and I thought what was most interesting about them was that they aren't actually in Venezuela, they're actually in Arizona and Missouri and Georgia. And I chose these three states because they are the states in the country with the highest cost of healthcare. And in 1990, the United States was ranked 6th in the world in terms of its healthcare and its quality and its pricing. And I felt like that was appropriate. As what is known as the greatest country in the world, that only makes sense. However, only 30 years later, we have dropped down to 27th place in only 30 years, and that's according to BusinessInsider.com, last accessed on April the 25th. Like I just said, the United States is the richest and most powerful country in the world, but unfortunately, we fall behind every other developed nation in the world when it comes to taking care of our own citizens. And that is why our government needs to adopt a Medicare for All universal healthcare system. And this is really important because according to a Harvard study, lives are at stake. That study was last updated on April the 26th, and it said that 45,000 Americans die every single year because they don't have access to quality healthcare or healthcare of any kind. And some things that I think that are really important to think about when discussing this topic is that A, life is a right, and to deny us our health is to deny us our lives. 2, no one who gets an unpreventable illness should be expected to pay that bill. And 3, health is public, and therefore health care should also be public. But I'll get into all that in just a second. As you all know, the United States is a part of the United Nations, and according to UN.org, last access on April the 25th, according to the Human Rights Declaration, so just to clarify, a human right is something that you get just for being a human being. It's not like a constitutional right. Like the Constitution says that you're allowed to have a firearm, but the government does not have to provide you with one, but you can get one if you want to. A human right is something that cannot be denied to you on any basis. That includes sex, gender, race, age, nationality, most importantly, in my opinion, economic status. Article 4 of the Human Rights Declaration says that every human being is entitled to the right of life. And to deny someone their health is to deny them their life. So to say that we can't, so to say that everybody can get sick but only a few can get well is wrong, and it's an infringement on our rights. Now, some debt we incur on purpose. We go into debt to buy houses, to buy cars, to invest in our education, and those are things that we are expected to pay back because we went to somebody and we said, I want this thing, and I'm willing to go into debt for this many years to get it. And that's fine. However, if somebody were to shoot me in the arm and I had to go to the hospital for life-saving surgery, that's not my fault. I didn't purposely incur that debt, so it should not be on me to repay that because it wasn't my consent to that. And it's definitely not fair to hand someone a bill for tens of thousands of dollars to pay just to live, even though we have that basic human right. Right now is a great example of this. Right now, the government is requiring us to stay inside, to isolate ourselves, to stop the spread of the virus. And that's because health is public. And if health is public, health care needs to be public because you physically cannot privatize the idea of health. So it's wrong to say that you can privatize the idea of health care. It's wrong to say everybody can get sick, but only a few of you are going to be able to get out of it. That's wrong, especially when 45,000 people die every single year from that. So obviously, the only higher authority that can really handle this is the federal government. So I wanted to kind of discuss some common arguments that I hear a lot, and the first one, the biggest one, is how do we pay for this? Luckily, we are learning right now that we can afford a lot more than we thought that we could. When the stock market first crashed due to coronavirus, within hours, the federal government injected $3.5 trillion into the stock market. And as a side note, $3.5 trillion is the amount of student debt in America. So when we say things like, oh, we can't afford to cancel student debt, we can't afford to pay for healthcare, we can, and we did, but we just did it for something else instead. Because I feel like our priorities are out of balance as a nation. The other common argument that I hear is the Emergency Medical Treatment and Active Labor Act, which essentially says that, like I said earlier, if I get shot in the arm and I have to go get surgery to live, they cannot deny me that care. And they won't, and that's true. However, you still get a bill in the mail for something that wasn't your fault, something that you had no control over, that could not have been prevented through any means of your own. Also, it doesn't cover medication. Type 1 diabetes is a condition that you get when you're very young. You just have to live with it, and that's fine. You have to take your insulin to live. However, due to for-profit private insurance companies, pharmaceutical companies are allowed to reap a 5,000% profit on insulin, which costs only $5 to make and hundreds of dollars to sell. And that's from rightcarealliance.org, last updated on April the 25th. So for these reasons, one of two things are going to happen. One, somebody who has some weird symptoms, some undiagnosed illnesses, decides to not go to the doctor, not go to the emergency room because they say it's not worth that bill. And we can't really say that's their fault because that's reasonable. It's reasonable to not want to pay tens of thousands of dollars for something that's probably nothing. But most of the time it is something. The second thing is that someone who is diagnosed now is faced with a choice. Am I going to feed my children, or am I going to take my insulin? And as a side note, these people usually choose their families because these are good, hardworking, normal people who just want to provide a roof over their children's head. And it's wrong to make them make that choice between their life and their children's life. So another argument that I hear is that if you want health insurance, you should just go get a better job. However, that's not a fair argument either, because we still, if you say it to a McDonald's worker, just go get a better job, we still go to McDonald's. We still need those workers. We still need them to be there. And the federal minimum wage was created by FDR to be a living wage to sustain a family, even though it might not be that anymore. That's why it was created. So that uneducated Americans, for people that can't get education, who can't afford to, who just don't want to, can still afford to feed their families, because not everyone can get education. So like I said, the government needs to adopt a universal health care system like every other developed nation in the world has that functions correctly. And the way that us as individuals can do something is just by being here and by understanding. We are a part of a younger and more progressive generation that is really fed up with the status quo. So I think that by the time we're old enough to vote, to hold office, they're not going to have any choice but to listen to us and to at least compromise with us. Because can you imagine if 45,000 more people were allowed to live, and were allowed to have jobs, and were allowed to feed money into the economy, increasing our GDP? Because that is the greatest country in the world. And as much as we want to be the greatest country in the world, and we can be, we're just not yet. And there are steps that we can take to be there.